November is National Diabetes Month, and the theme for this year is Take Charge of Tomorrow, Preventing Diabetes Health Problems. Now celebrating its 10th anniversary, the Maria Holder Diabetes Center, located in Warren St. Michael, has been in the forefront of looking after the needs of diabetics and pre-diabetics in Barbados. Whether it's diabetic eye screening, vascular screening, podiatry services, advice on nutrition, our range of diabetes specialists, doctors and nurses are available to fulfill your diabetic needs. Call and make an appointment today at 243-3937 or 417-0305. The Maria Holder Diabetes Center. BARP members get 10% off.
A good morning to the 100.7 QFM family who are tuned in right now. This is Peter Boyce here, and we all should be in a celebratory mood today. First of all, today, Thursday, is Q Day. So I know a lot of the QFM family is getting ready to go out and enjoy themselves at Q in the community.
I'm ready!
And it's also November as we celebrate 58 years of independence this month. And also, November is Diabetes Month, and you'll be hearing more about that in these 15 minutes, which is being sponsored by the Maria Holder Diabetes Center along with the Barbados Diabetic Eye Screening Program. If you are diabetic or pre-diabetic, make sure and listen to this show because all the diabetic services you will ever need and more you can find at the Maria Holder Diabetes Center located in Warren St. Michael, right behind Eunice Gibson Polyclinic. You can't miss it.
So they got diabetes doctors down there?
Yes, they have diabetes specialist doctors like Dr. Diane Bradford, Dr. Clark, diabetes specialist nurses. All of these you can find at the Maria Holder Diabetes Center.
What about if my legs swell up and I feel like I got bad circulation? They could do anything for me down there?
Yes, they can. You can get a vascular or ABI screening with a state-of-the-art machine at the Diabetes Center. Let's hear what vascular patient Donald has to say about this test.
Once you have reached 50, you need to go and get that check done. It's peripheral artery disease. It's a simple test. It's called an ABI test. What they're looking for is to see the blood flow in your lower extremities. And I can't stress enough the importance of getting this test done. I'm glad to know that the Maria Holder Foundation is offering this. Individuals need to go and get that test done. It's a simple test. It's all external. Again, it's like taking your blood pressure on your lower extremities.
Okay, so what about if I want to lose weight so I can look like Rihanna? They got anybody down there that could give diabetics advice on what to eat?
Yes, you can find nutritionist Victoria Cox at the Maria Holder Diabetes Center. You can call and make an appointment with Victoria, and she can design a personalized meal plan specially for you. If you want to know what to eat, don't go out and ask in and everybody to give you advice. Don't go and get a fake news. Make an appointment with Victoria Cox. She can design a meal plan for you. And speaking of meal plan, you know it is independence, and I know a Bajan delicacy that Bajans like to eat is bakes.
I like eating bakes for true.
So let's hear from nutritionist Victoria on if you can make a healthy Bajan bake.
So when I get the question of how can we make something like Bajan bakes a little bit healthier, it's difficult to answer because bakes are one of those foods that I find difficult to quote unquote healthify while maintaining the essence of what the food is and what someone might enjoy about it. Because the reality is bakes offer very little nutritional value in the sense that, the main ingredients are typically flour and sugar, which means that they are very common culprits for spiking blood sugar in those persons living with diabetes. And of course, on top of that, they are fried, making them high calorie, higher in fat. So just not an ideal food for most of us. But they are something that people enjoy as is. And I think, how could we make this healthier? You could reduce the sugar. You could maybe use a whole wheat flour. But it's still not really offering much valuable nutrition. If you don't fry it, it basically turns into something completely different. So, for those who are creative, by all means, you can play around with making it a little bit healthier. But my suggestions are ultimately going to be, if you are going to eat bakes, still try to have them as part of a balanced meal. So include some protein, for example, at that meal. So if breakfast, you could pair it with some eggs, for example, and you could even top it off and get some fiber in there by balancing out with a little veg. So have some, cucumber and tomato on the side along with the eggs and your bakes. Keep the portions small. And you just try not to have them all that often in the grand scheme of things. So, reducing the frequency of those foods that maybe we enjoy and that are difficult to make any healthier. It's not always about completely depriving yourself, but less often can be the answer.
Thank you, Victoria. Another service the Maria Holder Diabetes Center supplies is diabetic eye screening. That is when you get your eye screened for diabetic retinopathy. Once you are diabetic, you're supposed to do that every year. So you might be wondering, what are the symptoms of diabetic retinopathy? For the answer to that, we bring in clinical lead of the Barbados Diabetic Eye Screening Program, Dr. Charles Spears.
Vast majority of people who have diabetic retinopathy, they're going to experience no real symptoms. So in the mild, moderate, or severe class of diabetic retinopathy, there usually are no symptoms of the disease. However, if you start to develop, for instance, leakage in the center of the macula at the very back of the eye, then you can start to lose that central vision. So you get cloudy vision in the center area. So faces, for instance, if you look directly at someone, appear blurred. You're not able to distinguish letters or have difficulty reading. So that's what can happen when you have macular edema, which is a term for leakage in the center of the retina at the back of the eye. You could also develop these abnormal blood vessels that grow on the retina, and they can start to bleed. So you might notice new onset of floaters, and sometimes they appear red. So you know that's actually blood in the eye. And these abnormal blood vessels that are there, they can start to scar, like a scar anywhere else on the body. And when they do that, they pull on the retina, and they can actually pull the retina off. And in that case, you can have a significant loss of vision as a result. So those are the two main complications that we're trying to avoid with diabetic retinopathy screening.
So remember to call and make an appointment for diabetic eye screening 243-3937 as we go into our Q song of the day. You might be dancing to this one at Q in the community later as we celebrate 58 years of independence and Diabetes Month. This is Edwin Yearwood with a patriotic number, Doing This Again. Compliments, the Maria Holder Diabetes Center.
Love your country, one and all. We're marching on. Every time it comes around, we'll have a ball. That's why I'm doing this again. Proving this again. Doing this again. Proving this again. Doing this again. Singing out happy birthday to my land.
The Maria Holder Diabetes Center, serving you through Diabetes Month and beyond.
History was written way back then. We're marching on. This land came a long way and we still moving. It's ours. Young and old embracing now as one. We're marching on. We can't take for granted this celebration. That's why I'm doing this again. Proving this again. Doing this again. Proving this again. Doing this again. Singing out happy birthday to my land. Hip hooray, hip hooray, happy birthday. Hip hooray, hip hooray, hip hooray, happy birthday.
Don't fail me now, come on feet, don't fail me now, come on feet.
Wait, this is the Foot Corner segment. I got a question for Dr. Podiatrist Louise Robinson. You know, Q in the community later today, and it's a big Independence weekend, so I get a pedicure, and my foot look pretty like Rihanna one. So I would like to know, as a diabetic, if I get a pedicure, if I still need to go and see a podiatrist.
Well, obviously, pedicures are nice for everyone. It's a nice cosmetic treatment and it's relaxing and having your nails painted. But, we as podiatrists, we can look at preventing, which is really important when we come to diabetes. We need to do more prevention. We shouldn't be waiting for the problem to happen. So So as soon as you hear that you've got diabetes, you should be having checks. We can do that. We can look at fungal infections. We can look at bunions, and we can look at your ingrown toenails. We can prescribe medication, and we can even put inserts into your shoes to help you walk better. We treat plantar fasciitis, heel spurs, and most important, when those people who sadly have already lost a limb, it's podiatrists the ones can help rebalance your walking and put inserts into your shoes to help you walk again. So there's a massive difference between podiatrist and pedicure. So we shouldn't really, I'm not saying we shouldn't go and have our feet painted pretty, but when it comes to about diabetes, we need to have a closer look. So we should be doing the toenail cutting, because if sadly they're cut by somebody else who doesn't realise there's been a cut made in the foot, we send that patient home. It only takes 72 hours for an infection to occur, and then when it's missed, that's how amputations happen.
Thank you, podiatrist Louise Robinson. Remember that Louise will be doing foot screening at the Maria Holler Diabetes Center on Saturday, the 14th of December from 9 a.m. to 1 p.m. Call and book an appointment 417-0305. Bring lawyer for outcome the 14th of December. Make that a foot date.
The Maria Holder Diabetes Center, serving you through Diabetes Month and beyond.
We now go to Dr. Diane Bradford from the Maria Holler Diabetes Center for a patient story.
Now, although it's time for a patient story, the person that I had lined up for a patient story, and trust me, this was a good story, but then she said, no, Dr. Bradford, I'm sorry, I'm too shy. And I was like, please. And she's like, no, sorry, I'm too shy, I don't like to do stuff like that, but I'm going to just still share her story. So this lady is past her 50s. She's had diabetes for over 30 years. She's using insulin. And we really struggled for a bit trying to get her blood sugars controlled. She actually attends one of the polyclinics regularly and was referred on our polyclinic program. And after kind of picking up, why aren't we getting there? She seemed to put over that she was doing everything right. But then I figured out in the end, no, she wasn't doing everything quite right with her lifestyle. So, of course, I sent her to have some intensive sessions with our dietitian, Victoria Cox, and bingo, success. So after the first visit, I was like, yeah, we're on the way to something good. After the second visit, I'm like, okay, my lady, I want to see you back in 6 weeks. So after 6 weeks, she dropped 7 pounds by changing her diet. She also dropped her blood sugars from being between, say, 9 to going up to 14 and 16 during the day to 4s to about 8, with probably 1-9 during the day after food. I'm like, how fabulous is that? After having diabetes for 30 years on insulin, she changed her diet. She's still on insulin and medication, mind you. However, I can see very soon that we're going to have to start cutting a few things back, and she stays on her current trajectory. And although we do the HbA1c, or the 3-month average, every 3 months, I said, no, I'm doing hers in 6 weeks because I just needed to be sure she was going in the right direction. And she's had a massive reduction, normally a reduction that we see over 3 months or more. She's dropped her HbA1c by over 3%, and I'm pretty sure it's going to be all the way down in another 6 weeks' time. So congratulations to you, my dear.
If you are diabetic or pre-diabetic and listening to QFM right now, remember Q also stands for quality. Quality health services at low prices, which is what you will find at the Maria Holler Diabetes Center located in Warren St. Michael. For more information, call 243-3937 or 417-0305. You can also follow them on Instagram or Facebook. So as you go out enjoying Q in the community today, remember to try and eat healthy, and don't miss next week when we'll be dealing with more diabetic issues. Same Q time, same Q station.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
But it's just again to re-emphasize the importance of good diabetic care. And diabetic care it involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren St. Michael, is your source of diabetic care. You can reach them by calling 243 eyes